Hello, ladies, and possibly husbands as well, because I know you clicked, because we are talking about Dr. Bradley's Husband Coached Childbirth book. This is a phenomenal book. But let me introduce myself. I am Tabitha. I'm a personal trainer for over 13 years, a pre and postnatal corrective exercise specialist, but most importantly, a mom of 5. And so we're going to review this book. Join me on this book club. What we are going to do is we're going to review each chapter. Today, we're going to do chapter 1 and 2 because they're quite short. So we're going to go over them. I'm going to talk about my experiences as a mom delivering with and without reading this book. I did not read this book until I was about to deliver my 4th child. So I was pregnant with my 4th. So 3 pregnancies without this book, and then the past 2 with this book. And it is such a game changer because it teaches you so much. It's probably my favorite pregnancy, birthing, and postpartum book that there is on the market. And I just want to tell you, I'm sorry in advance. I do have 5 children, so there may be a little bit of background noise or humans in the background. So please do not be disturbed by that. So we're going to talk about Dr. Bradley's Husband Coached Childbirth book. If you have not read chapter 1 and chapter 2, you can either listen to me first, or I would recommend go ahead and read chapter 1 and chapter 2. Or maybe this is going to entice you to buy the book, which I will have it linked down below. It's very reasonable and such an easy read. So we're going to talk about it. We're going to skip over the preface, the foreword, and the acknowledgments of this book, which is probably about 10 pages, and we're going to go straight into chapter 1. Now, I have a lot of highlights here. So the basics of chapter 1 was Dr. Bradley was at a hospital in Toronto, and a film crew wanted to come in to record his training that he was giving to women, and he wanted to record an actual birth and a labor experience from the husband and wife that were then having a baby that had gone through his training. So chapter 1 is basically about that experience, and I've got a lot of highlighted, so I'm going to go through my highlighted, which will go through the chapter as if it does, and if I need to interject anything from my experience, I will. All right, so the first thing I have highlighted is babies cannot read calendars, and doctors cannot tell when labor begins. So the point of that in this story is the film crew wanted to know when these babies were going to be born, and he was like, no, babies come when they come. And that is so true. Babies come when they come. Our hospital system has a really bad habit these days, and for 2 of my deliveries, I had Pitocin administered for me to hurry up and deliver the baby. I didn't really know that that wasn't the right procedure to go through, but we were at Womack at Fort Bragg, North Carolina, and that is a baby machine factory hospital. So Pitocin was just a part of the delivery routine, and I was very ignorant to the fact. So babies just come. You don't know when they're going to come, and when you let your body just do its thing naturally, it is so much more beautiful. So these visitors that came with the film crew were very intrigued and delighted by the calm assurance of the young couple who went about their happy business of bearing a child they had been trained to do. So finally, a couple came in and were ready to deliver. The mom had felt that, I don't know what happened exactly, but labor pains had started. Didn't say that her water broke, but she had come in, and they were happy. The husband and wife just strolled in at the early signs of labor, and they were chatting. They were uninterrupted by the uterine contractions, and they were just joyous. And the observers could see no evidence of pain. And I'm going to say yes and yes and yes to that. As a mom who's had 5 children with 0 epidurals, having a baby when you are calm and collected and you allow your body to do what it needs to do naturally, it's actually a joyous experience. So during the contractions, the young mother calmly lied curled up, peacefully closed her eyes, and automatically relaxed all of her muscles. And the young husband tended to her. He directed her diaphragmatic breathing. I can remember even before I read this book, I just had the natural inclination, it might be from my personal training experience, to relax all my muscles and just relax my body when I was delivering. And so this is what the training instructs you to do, to learn to relax, because when you tense up, it is much more painful. In the prenatal classes, the husbands are instructed to repeat verbally during the contractions in an intimate, lovingly voice. So the husbands are there to guide their wives. You got it. You're okay. I love you. You're amazing. Whatever it is that husband has to say. And I can truly say, even though my husband never took this training, he was phenomenal at that. So when the muscle contractions of the uterus subsided, the chatter resumed, but it would be momentarily interrupted. Now, this is active labor. This is when your contractions are the hardest. They're explaining here in the book that the mom was going through these rough contractions, but in the time where she wasn't experiencing that contraction, she was able to chat with her husband and breathe and relax. But during the contraction, she was quiet, she was peaceful, and she was just breathing. And that's the way it should be. Whenever a contraction occurred, the same calm and relaxed pattern and abdominal breathing kept going. So it was just a pattern. As time went on, the interval between contractions gradually became shorter, and the chatter gradually diminished, and the parents concentrated more on their respective tasks. The close relationship between the wife and the husband, total dependence on each other, was heartwarming to see, and it truly takes two to tango. That was from one of the film crew that was in there, and they were like, whoa, it doesn't seem like you even need a doctor. Like, the husband and wife have got it under control. The doctor's role is vital only when complications occur. That is very important. Comparing birthing to swimming, doctor is a lifeguard. Both swimming and birthing carry an incredible minimal risk. So in case of an emergency, that's why you want your doctor there. But the doctor is not the primary person that should be calling the shots. Your body knows what to do. And that's why this book is so amazing, because it will explain to you how you listen to your body. So mothers are trained to deliberately relax all the muscles during uterine contractions. And this young mother shortly announced the urge to push, ushering the second stage of labor. Husband adjusted her pillows for her and put it behind her back so she could be on the bed in a inclined position. And so she was sitting back there, if you can imagine, and he adjusted the pillows so she can almost get into like on the bed, leaning back, squatting position with pillows under her arm, because the squatting position, as Dr. Bradley explains, is the most comfortable and easy position to deliver a baby, which I delivered three of them that way. Two of them that way. So it was the best way to deliver versus delivering on your back. So the husband resumed the coaching and adjusted the pillows as the contractions happened. And she curled forward and pulled her knees back under her armpits in the squatting position, downward on the downward tilted birth bed. And so this position served to open wide the soft tissues of the birth canal to allow a gradual descent of the infant. So the second stage, the infant passed from the uterus into the vaginal canal, and the uterus is now slowed down the frequency of contractions with longer intervals in between. So what he's saying is, once that baby descends into that birthing canal, you're not getting those contractions pushing as hard. So you're going to get a little bit more relaxed, even though you're delivering that baby. And here's what's incredible. So this is just the introduction. This book goes way into more detail about this whole process as we go on. So the baby was then put at the mother's side for the first introduction of breastfeeding. Now, the purpose of this form of obstetrician point of view was not primarily for nourishment, but it does give nourishment, but it is to activate the reflex that stimulates uterine contractions to separate the placenta and decrease the bleeding from the placental site. So in your uterus, you have this huge placenta attached to it, and that uterus needs to contract to slowly make that wound smaller so that the placenta will detach and you can deliver the placenta. As you nurse your baby, the contractions get harder and harder. Not too bad, but you can feel the contractions and it feels like abdominal cramping, and that is so that your uterus shrinks back down, and as it shrinks, that wound that you now had from the placenta, if you can imagine, every shrink, it just gets smaller and smaller, and that's what's going to stop your postpartum bleeding, is when that wound shrinks all the way back down and it heals all the way back up. So going on to that first breastfeeding, why it is so important, and I think a lot of moms miss the breastfeeding because maybe they don't want to breastfeed. They're missing that, and that is why hospitals administer Pitocin. So now we've got the first feed, which is a little bit of nourishment, but it's mostly colostrum, which provides immunities for the baby, the gut immunities to keep it safe in its new environment. The colostrum also starts the production of vitamin K in the baby's gut, building up to the peak on the 8th day, and is important for blood clotting. Colostrum also acts as a laxative to get the baby passing meconium, which cleans the bowels out and reduce the baby's jaundice. So breastfeeding with your newborn is so important because not only are they getting the nourishment from the colostrum, which gives them the gut bacteria to start making vitamin K2. K2 is made by gut bacteria, and the babies don't have that when they're first born, and a lot of hospitals want to inject with a vitamin K shot. But if you are a mom that has had no drugs during your pregnancy, no antibiotics, no anti-coagulants or anti-convulsing medication, then your body will naturally produce the colostrum that your baby can naturally produce vitamin K. On the 8th day, it gets up to the level that it needs to be. So your baby doesn't actually need the vitamin K shot. And after I learned that from this book, 2 of my babies did not get the vitamin K shot, and they are 100% wonderful. Now, it also helps acting as a laxative to pass meconium. So that's that black tar that's in the baby's intestines. So that all has to come out before the baby starts pooping properly. And if you're breastfeeding, it's going to be like yellowish poop. So such an amazing thing, and that's going to help reduce the chances of jaundice, because you don't want, hi Xavier, get your little booty out of here. You don't want the baby to have jaundice. That has to do with the liver toxicity. So you want to just everything to be flowed out and clean, and the baby just starting fresh, which is perfect. So breastfeeding it is. Each parent was given a celebratory glass of ice orange juice for the mother to replenish her blood sugar that was depleted from the utilization of the uterus, and to correct the drying effect of the mouth during mouth breathing for labor. So during labor, you get really thirsty, and Dr. Bradley recommends ice chips, but then after labor, some orange juice. I've never had orange juice afterwards. I like to drink my electrolyte packets from Seeking Health. It has potassium, magnesium, and all the electrolytes you need. So the orange juice also provides the sodium and potassium, and to prevent dizziness. So just something to keep in mind. It doesn't need to be orange juice, but maybe you do have an electrolyte drink to replenish your body, because it just worked so hard to deliver a baby. So Dr. Bradley, since 1917, he was delivered as a natural baby on his farm, observed animals on the farm, and he's been a teacher of natural childbirth. And I have seen this happy series of events repeated thousands of times. That was chapter 1. So that was a really big introduction, because you just got the whole into the hospital, the whole labor procedure, delivery of the baby, and a little bit of postpartum. And again, he's going to break all of this down for you. And let's start on chapter 2, the theory of natural childbirth. I'm sorry if you can hear the kiddos in the background. My oldest is with the 2 little ones. I've got the 3rd one over here being naughty in front of the camera, and my other one is being good at the table. Xavier, put your arms down, please. It's crazy here. It's crazy in this house, but it's beautiful. It's a beautiful experience, and I highly recommend, again, this book. So Dr. Bradley grew up on a farm, and he always saw animals being birthed peacefully and unassisted. And he said, why can't a human animal do this? What makes it a big difference? So he witnessed no objective evidence of pain or suffering in the animals, and the animals' mother's eyes were radiant with joy and happiness as they delivered their baby. And so he said, then what is the difference between a human and other animals? Actually, they're remarkably similar. So he explained how they use cats and dog bodies as pre-medical anatomy studies because they're so similar. So animals instinctively do something that keeps the birth process from hurting. And why don't us humans do that? Humans are apparently lacking this instinctual knowledge to do the wrong thing, and the wrong thing hurts and prolongs labor. So whatever we are doing as adults, humans, we are making labor worse for ourselves versus what the animals do, which is such a peaceful process. So in the 1940s, women were changing, a little bit of history, from birthing at home to birthing in hospitals. And that's where they gave birth alone. Their husbands weren't there. Their closest family members were not there with them. But this then led to birthing becoming a mystery for the next generation. So the importance of natural childbirth training is that it displaces this ignorance or this superstition, fear, or anxiety. So there is nothing more marvelous to behold than an expert, educated, trained human mother giving birth. It really is a beautiful experience. Are we doing this naturally or medicated? Can we do it naturally and beautiful like an animal? Or is it really necessary for women to suffer in pain? But he says, must women lose their dignity and self-control in labor from the drunken effect of medication given in the vain attempt to make labor pain-free? Is that necessary? Women, just ask the women who've tried the medication method. Now, let me interject here. So on my first delivery, I had said, nope, I'm not doing an epidural. I'm going to do this 100% natural. So with my first one, I was in labor for 23 hours, and I walked in and I said, no, I'm not doing any epidural. And the nurse literally laughed at me. She was like, oh, ha, ha, okay, that's what they all say. I was at a military training hospital, and I went through 3 entirely different crews of probably 4 to 5 people. I mean, it was probably the worst delivery experience, but to me, I'm a very positive person, so it bothered me, but not too much. Well, I was in labor and I was doing fine. I was just tired because I had been up all night, just kind of excited, not knowing what to expect. And then the change of midwives and doctors and nurses really kind of takes a toll on you. And so my husband had asked, is there anything we can give her to like,
this is for Baba, if you can.
So we can like help ease the pain. She doesn't want an epidural, and I really didn't need anything to ease the pain. But they did say, oh, we can give her phenergan. It doesn't take away any pain, but what it does do is it's an anti-nausea medicine, and it will relax her and allow her to sleep. So they did give me that, and it was the worst experience, and I would never recommend that. I did nap, which helped labor progress, which is a good thing. However, I felt like I was in the clouds. I was not there. I didn't like the feeling of it. It is really terrible. And we'll go on to more medications later in this book. But every delivery after the first one have just been better and better. And ironically, every delivery after my first delivery has been more and more and more natural with less intervention. As Dr. Bradley points out, if you ask women who had an epidural, a lot of them will say lots of times they couldn't have done it without the medication, and everyone should take the epidural. But just remember that no drug, including drugs in epidurals have been proven safe for an unborn baby. For 9 months, women are warned to stay clear of all drugs in order to protect their baby, yet at the time of birth, this is forgotten. Medicated women don't know what they have missed or what they are actually capable of doing. A woman interviewed a bunch of other women and asked, these were the mothers who used a medicated method. And these are the responses that this woman got. Natural birth didn't work for me. My body doesn't work. I don't have time for those classes. Many mothers said they loved their new baby and thanked the anesthesiologist for taking away the pain, but never again. Worst pain I've ever known. Most terrible experience of my life. I know it's my fault, but the pain in my back has never gone away from the epidural. You don't have to be a martyr. This is the 21st century. They all seem to believe mistakenly that these sophisticated, complicated drugs do not get to or affect their baby. But then that same mother interviewed mothers who did it naturally. And the mothers responded, it was wonderful. The most beautiful experience of my life. Why would anyone want to be asleep at such a wonderful moment? Giving birth was one of the most exciting, life-changing experiences of my life. Experiencing natural childbirth has made me realize how powerful I am. If I can birth, I can do anything. Some of the mothers even use the term birth climax. What that really is referring to is that you feel pain. So what that is referring to is you're feeling the contractions and the pain and all of this, and it's wearing on you. It's like a workout going through this. And then you finally deliver that baby, and you get a rush of oxytocin, a rush of dopamine, just a rush of all the feel-good hormones, and the pain is quite literally gone. It's gone, it's done. Yes, you're gonna have contractions again, but they feel like cramping, and that's when you're breastfeeding. But all the birthing pain is gone. So the rush of emotions that you feel is like a climax, and it's such a joyous experience, something that you probably don't experience when you are drugged. I can't quite remember. I was a little bit loopy from the drugs when they gave me for my first son, and I remember birthing him, but it wasn't quite as joyous as my last two, which were completely 100% natural. Quickly, we're going to talk about anesthesia, and we're almost done with this book. So general anesthesia is still used, and they are spinals or epidurals or walking epidurals. So some moms will be like, oh, I could still use my leg. It was a walking epidural, which is a combination of the spinal and the epidural, along with all the side effects from both of them. So these procedures are cocktails of drugs, including narcotics such as lidocaine, morphine, fentanyl, and many others. These drugs go to affect the baby within 3 minutes, and studies have done where they did scalp and vein samples taken from the baby, and they are found in the baby's blood after just 3 minutes of given to the mother. So additionally, these drugs affect the important natural process of breastfeeding, because there's a fear that the mother might become nauseated and throw up. So she's often given drugs to dry up the secretions in her stomach, which then dry up the breast milk, which makes breastfeeding challenging. And with my first son, I experienced severe jaundice with him, trouble breastfeeding, and that was likely all due to that phenergan that they gave me. It was quite literally a horrible experience. So after 46 years, over 23,000 attended births of natural childbirths. The only handicap Dr. Bradley found in this method is the super enthusiasm of parents afterwards. Women can give birth by the action of their own bodies as animals do. Women can enjoy the process of birth and add their dignity by being educated to follow the example set in instinctive animals. Women can take joy and pleasure from the privilege of being women and bless God for being able to give birth instead of showing snarling hostility towards the men who love them because men don't have children. That was chapter 2. I know that was a little bit long, but it's such a good book. The intro was heavy, and then chapter 2 was pretty heavy as well, because now we're talking about natural childbirth and anesthesia. And I will continue giving you my stories and examples as we go through this book of how it worked and how it didn't. Now, my first one I said had severe jaundice. I had phenagrin with him, pure mistake. And I didn't know any better. I also had Pitocin with him, and they gave me antibiotics. So they gave me a lot of stuff. My first 3 children did have the vitamin K and the hepatitis B shot. I didn't know any better, but now knowing that antibiotics affect the baby's ability to create vitamin K in their bodies naturally, then they needed the vitamin K shot. And then we'll go on, and I'll talk to you guys about how baby number 4 and baby number 5 were just so perfect. Literally no IV, no intervention whatsoever, all natural home birth. And one was a home birth, one was a hospital birth. And that was after reading this book. When I went into delivery with my 4th and I took this book into the delivery room, the midwife said, "Oh my gosh, you're reading Dr. Bradley. I wish more women read that book." And I said, "Why don't they tell women about this book?" Never once in a prenatal appointment did I ever get recommended this book. And the midwife had then said, "It's so good that you're not doing anything, because once you get on that intervention train, you don't get off." And so that affects your ability to have a natural delivery. So I hope you guys enjoyed chapter 1 and chapter 2. I know it was a little bit long, but I'm super passionate about this. I hope you learned a lot from this book. And then we're going to go on. So look for, I don't know if it's going to be this side or this side, look for chapter 3, and you can go on. And even if you don't read the book, I'd recommend you to. But even if you don't, I'm hoping to give you all the nuggets you need. So if you like this kind of stuff, go ahead and subscribe. We're going to go through this whole book, and then you can give me recommendations of other books that you guys would love me to review. As always, stay positive, work hard, and God bless. Aloha.